So my name is Leah Katzer, and I'm the statewide program director here at JA of Washington. We're so excited you could join us this afternoon for our Lunch with Leaders series. I will give a quick introduction, and then today's leader will share their story for about 15 minutes, and then we'll have about 10 minutes of questions at the end. Please feel free to put your questions in the chat box to me, the host, during the session, and I will share them out with our leader later in the session. Educators and parents, please put a note in the chat box to let me know how many students are joining with you so that we can accurately track our attendees today. Our session today is generously sponsored by Luther Burbank Savings. Luther Burbank Savings has supported junior achievement for more than 2 decades in California, and we're thrilled to be now partnering with them here in Washington. Thanks to the generosity of Luther Burbank Savings, we'll be picking 2 educators for joining us today to receive gift cards as tokens of our continued appreciation for your partnership. So thank you so much for everyone for joining, and to Luther Burbank. So here is Ken Jackson, Vice President and Branch Manager at Luther Burbank Savings Bellevue Branch, to introduce our leader today.
Good afternoon. As Leah mentioned, I'm Ken Jackson, Vice President and Branch Manager at Luther Burbank Savings, located here in Bellevue. We are proud to sponsor this exciting series because JA's passion and commitment to providing engaging financial literacy curriculum is equal to our own, which makes partnering with JA a natural fit for Luther Burbank Savings and our employees. I am pleased to be able to introduce Tasleem Kachra, who is a Senior Program Officer at the Bill Melinda Gates Foundation with the Global Delivery Programs team, working to improve the delivery of health products and services, facilitating health system innovations to advance health equity. Tasleem has built her career in global public health and has worked in rural areas in both Uganda and Kenya throughout her career. Tasleem, I'll hand it off to you to get it started.
Thank you, Ken, and thank you, Jay Washington, for everything you've done to put this together. I hear that you are connecting in, all of you, from all over the country. That's amazing. It's been a strange year. It's been hard, but it's also been some amazing opportunities like this where you get to do things you might not have done otherwise. So thank you all for connecting. So I hear you all are here because you are interested in learning about different careers and different things that people do in their lives. And so let's dig into that. I'll tell you a little bit about myself, and then please do send in questions for other things that you want to hear about. So I'm going to do this in 4 parts. One is, who am I? Second is, what do I do? Which Ken mentioned a little bit. Third is, how did I get here? And fourth is, why do I do what I do? So first off, who am I? I was born and grew up in Nairobi, Kenya, which is in East Africa, and I finished high school there. And then at that time, my family got their green cards, which made me eligible to live in the USA. So I came to the US when I was about 18. And it was coincidentally the time when I was able to go or ready for undergrad. And I got my undergraduate degree in Boston, Massachusetts. Type into the chat which city you live in now, and if you want to, where you grew up and where you lived when you grew up. So coming to the US from Nairobi, it was hard, but it was amazing. It was like tall buildings, and the culture was all different, and the food was all different. I couldn't believe how many cereals were in the cereal aisle. It was crazy. I've gone from like 3 cereals to an aisle of cereals. It was all fascinating. And then really there was just all this stuff, these amazing opportunities I'd never had access to, never heard of before, and more on those later as we go through. But I did realize after a couple of years of freaking out that it would be smart and fun to take advantage of all these new opportunities. So more on that when I get to the how and why I'm here. So a little bit more background. It was also the first time I had seen snow. I had no idea how to dress. Like a denim jacket was the warmest thing I had. And luckily I had a really cool roommate at undergrad. And she took me shopping. She was super nice. And I think she was fascinated by the fact that I didn't even have a jacket. and told me what kind of coat to buy for a Boston winter, which for those of you who are on the East Coast know what that's like. Even later on, when I met my husband, my now husband, he taught me how to wear layers for skiing. And I figured I should learn how to ski because even though I kind of hate that wet, cold snow down my neck, he used to be a ski instructor. So I kind of figured I should put my game on and make sure I can keep up on the ski slopes with him, which I did okay. So I moved to Boston on my own. So after 18 years of living like in a small house with my parents, my brother, often my grandmother was living with us. People always wanted to know if I missed my parents and my family. And I did, but I kind of liked living on my own in a place where I knew no one. I was already challenging norms and questioning why people do certain things just because that's the way they've always been done. And I think moving from Nairobi to the US to Boston helped me to appreciate sudden changes in things that were done differently. And I still do that today. And I think that's helped me get to where I am because I'm curious and I want to know what's happening and why. So anyway, formal training. I did get my undergraduate degree in Bachelor of Arts from Brandeis. I found it really hard to pick a major. I first tried mathematics, decided that was kind of not my style. And then I picked pre-med, and that was really cool work and interesting things to learn. I wasn't sure if I wanted to meet with sick patients all day, every day. That I had to learn what I didn't like as well. And then I picked marine biology, which was awesome. And then I got an internship back in Kenya, but that fell apart, which I can tell you about later. But I really ended up finding that I loved biology, and I got to work at the Boston Aquarium and learned so much about marine biology. So I ended up finally picking a major of biology. I did get a little note in my mailbox in my junior year to say that if I didn't pick a major, then I would not be allowed to come back to my junior year because I just found everything so interesting and hard to like pick one thing. So it was a great experience. I just felt like trying everything. I wanted to try everything. And I think that's what helped me get here today, was trying things that were available to me. So once I got into undergrad, there's so much going on there. I did swimming classes. I was an EMT. I worked with the university police. I worked in a lab. I worked in the library. I worked at Arby's. I just kept trying all of these things that were available to me. So I did go to work in Nairobi then for a few years, and I'll tell you about that later. Then I came back to the US and went to grad school, and I got my master's of public health, as well as my MBA, my master's in business administration, both from Yale. And at that time, there was only 3 people at the business school who were allowed to do both, or allowed to do 2 degrees at the same time. It's a tough program. Usually they are 2 years each, but if you do it joint, you get to do it in 3 years, which is hard. But on the other hand, I got to do 2 internships, which again, as you're starting to notice, I like doing lots of different things. So I got to do 2 different internships at 2 different places. And again, that was helped me to try different things and learn what I want to do and what I want to be. Okay, so that's number 1. Who am I? Let's go back to the other 3. The other 3 were, what do I do now? How did I get here? And why do I do what I do? So what do I do? As Ken mentioned, I'm at the Bill and Melinda Gates Foundation. And the foundation philosophy is that all lives have equal value. And we impatiently but optimistically work to reduce inequities or reduce inequalities that some people might be facing. If everyone has the same chances and opportunities, then everyone would have a chance at making a better life for themselves. And that's what our intention and the goals are. We want to ensure that especially children and younger people survive and thrive. We want to empower the poorest, especially women and girls. And we want to combat infectious diseases, especially for the poorest. And that might be one you're really familiar with these days from COVID. COVID is an infectious disease, and all those things you hear about are the things that I do at work. So we can get into those details later. And in particular, we want to, and we work towards inspiring people like all of you to take action to change the world. So at the Bill and Melinda Gates Foundation, the team I'm on is global delivery. And I've been there for about 12 years now. I've worked in 3 main areas. I've worked to help provide health products and services to the poorest governments and countries. That is basically ensuring that the governments have access to vaccines, to birth control, to better training programs, to helping them with the funds for their health system. So making sure they have adequate funds allocated to health, and how to improve their clinics even physically. It's kind of like, you don't want to go to school where there's no desks or no windows. And so the basics even of the clinics where they go for healthcare, we help support that those are appropriate for people to go to. And so I help make sure those products like vaccines and family planning products get there, and also the services like training and the clinics and the finances. I work with the governments on all of this, especially on immunization or vaccines. That's my area of focus mainly. And 3 is I work with communities to ensure that they have the right accurate information on the products, so that people know how to get them and where to get them, and how to make sure their voices are heard. If they're not getting something that they should have, then the government should be listening to them and helping to provide that. And again, all the things you've heard on the news for COVID, like where is the manufacturer who's making the vaccine? How are they shipping the vaccine? What happened in the snow? The vaccine got stuck at FedEx or UPS or whoever was shipping it, didn't make it to Washington State. It was a week delay. All of these things, this whole system of delivery, where are the funds coming from to buy that vaccine? How do people know where to go? How do people know where to sign up for the vaccine? All of these things are exactly the same that we work on in other countries and with other countries. So our headquarters, the Gates Foundation, is in Seattle, near the Space Needle, for those of you who are in Seattle and know Seattle. We have a few offices in a few countries, for example, China, India, London, and Ethiopia. And there's probably about 1,500 people in Seattle and probably about 500 people total in the other offices. I've kind of lost track a little bit since we haven't been in the office. It's hard to know who's new and who's gone when you're not in the office, when you've got 2,000 people. I've been lucky enough to travel. I love traveling. Again, it's all about those new experiences and meeting new people and learning new cultures and seeing new things. And I've been able to travel to a bunch of countries to get my work done. For example, Kenya, Zambia, South Africa, Switzerland, Croatia, India, Pakistan, and Oman, to name a few. So I hope you all enjoy looking those up after the session is done. The downside for this work is the time zones across all these countries are so different. I have to get up and get on the phone with a country at 5 in the morning because it's their 5 in the evening, or sometimes my 10 in the evening, which is their 10 in the morning. And every once in a while, not before, but since COVID and since we've been home, I've had and not been able to fly there. I've even had like 3 a.m. conferences. So that's also something you just have to know if it's worth it. If you like the job enough to do that, and I do. So I'm sticking with it. Okay, so we've covered who am I and what I do. So we go to the next question is, how did I get here? And I think I have like 5 minutes. You can pardon me if I go over. So mainly, I just took advantage of the opportunities that came my way. It's not like you have to pay money. You know, there's so much, especially nowadays, even more online like this. And I tried to do anything that I could. And I thought about the choices when they came along at each point in time and made those choices. I didn't really know where I wanted to be. I didn't know I was wanting to be at the Gates Foundation. The Gates Foundation did not even exist at the time, 15 years ago. So it kind of chose me, and I kind of chose it, in that I thought about the choices and opportunities along the way, and they led me here. So challenging things, challenging what people said, and curiosity, I think, got me a long way. For example, I had an advisor who was insisting that I do a PhD, and I thought about that a lot, and I thought about why. Why do you get a PhD versus why do you get a master's degree? And that's when I ended up choosing a master's degree, and then choosing to do 2 master's degrees instead of a PhD. And those are just things that, you know, I had to think about why, and what I was interested in and what I would do with it. So it was a long road of looking at those options. But again, it's amazing what's out there. And I talked to as many people as I could, like this session. The job I'm doing, I did not even know existed until I was working between undergrad and graduate and talked to a friend, and she mentioned public health. And I was like, oh, what's public health? And so it fit really well with my interest in sort of that pre-med, but working at a community level and protecting people instead of waiting till they're sick. I also found a life partner that is very supportive and is okay if I'm up at 3 a.m. and have to get and start talking loudly. He's okay with that. So, you know, these are all important things in life, and choices that come along. You know, I had to learn that some people look at me differently and treat me differently because I'm female, because I'm brown. And I learned to work with it, or I learned to work around it, or I learned to take advantage of it sometimes. And those are just things that everyone has to learn, or some people have to learn. And I had to figure out what skills I liked and didn't like, and I still had to learn them. I was telling others before we got started that I don't love presenting, but I know that it's important, and it helps me get my job done, and it gives me opportunities. Like I have to present to Bill Gates or Melinda Gates, and I've done a few of those. So I do have to practice everything, whether I like it or not. As I mentioned, I was an EMT. I did scuba diving. I did springboard diving class at grad school. I worked at the aquarium. I did study abroad, reading, painting, teaching. I did some teaching. I did yoga. I did meditation. I did rowing. I did gender studies, cooking, all kinds of museums and concerts. Again, like this is all like, it's amazing. It's like all free online now. And so just really taking all of that stuff to figure out what I like and don't like. And then of course, all the resources that are available, again, especially online now with libraries and career sessions and online videos and presentations for like anything you want to hear these days. So that's that on why I'm here and how I'm here. Oh, no, that was the how I'm here, and now why. So why do I do what I want to do? And actually, this is the easiest question for me to answer. I love all the things that the foundation stands for and does. And I mentioned these earlier. I'm just going to mention them again, like about myself, though. I believe that if people have chances and opportunities and they are looking out for them and take them, that everyone would have a chance at making a good life for themselves. And I am really happy to be a part of helping people have chances and opportunities. I particularly the children and the young people, helping them survive and thrive. I got my little kids up on the wall there. It's some art when I used to live in Nairobi that I got those. So children and young people are the future, and so being able to support them is amazing. Empowering the poorest, the women and the children, like for sure. Again, that's half the population, and if we support women and children as much as men and boys are supported, they will really increase the whole value in the world and in our lives. And particularly in infectious diseases like COVID again, especially for the poorest, and preventing those. Because if you are well, healthy, and educated, you can really take advantage of those opportunities that come along, and hopefully be inspired by all of this, so that you can take action to change the world. So I hope I was able to interest and inspire you all into thinking about finding out what you want to do in the world, and I'm open for questions.
Thank you so much. Folks, if you have questions, please feel free to put them in the chat box and I'll get them over to Tasleem. We have a couple that were submitted when folks signed up, so I can start there. Let's see here. What job did you mentioned you had a lot of jobs along the way. Which one taught you the most, like before you got into your career?
Yeah, so I think I might have to talk about two of them because it was very different things that they taught me. The first was in public health, which was in Kenya and Uganda. And I was working in the communities and really learning, asking, talking to them about what their needs were, and focusing on public health and health areas. And so I learned about health in the community from that job. And then one of my jobs was for a pharmaceutical company. And in the pharmaceutical company, I learned about those tensions that people talk about. It costs a lot of money to make a new vaccine or a new drug, and people complain about the costs. So there is this balance that has to happen. I learned a lot about that. How much does it cost to make a vaccine and deliver it versus people having to pay for that? And that's where governments come in or other foundations come in, and they can help decrease that cost for people who are most in need. I also learned a lot of the whole other business, like all the business sides of things, like how to do spreadsheets and how to figure out how much things cost and the pricing and how much you need, how do you figure out how much you need, where do all the ingredients come from? Just like if you're making a cake, you have to get all the ingredients and then mix them all together to make your cake. And that's the same thing for making vaccines or other treatment products. So the public health side and the business side, I think, were the two jobs that taught me the most.
Great, thank you. What advice would you have for young people who are going to, in the next year or couple years, move out on their own for the first time? You mentioned that you moved to a completely different environment. So what advice would you have for folks who are embarking on a similar adventure?
Yeah, I think be comfortable that it might be weird, hard. You may or may not like it, but I think take advantage of all the opportunities it gives you. And, sometimes when you're out on your own and nobody, there's like an opportunity to almost reinvent yourself, to do things. I'm talking career things, to do things that help you learn new and different things that sometimes would just be not quite what you would think of doing if you were at home. So I would say, yeah, might be difficult, but that's okay. Just, accept that and keep it as part of you, and also take advantage of it.
Thank you. Let's see. How do you prioritize? How do you juggle all the different things that you do?
Yeah. It's kind of fun. Like people at work, some of my managers and directors actually send other people to me to talk to me about this, about work-life balance and how I even prioritize my work. I look at what do I get out of something? Like, what do I get done? what is the achievement? How's that? What is the achievement that I can have by doing something or not doing something? One way to look at prioritizing is what happens if you don't do something, and what impact or problems does that have? And so at work with my projects, I have a list of them that every quarter I go over with my manager, and we agree on the priorities, and what's important to get done at work, and what I'm like not able to do, because there's always 20 things you can do, to help in the world. But you can't do all 20, you can only do 10. So how do you pick the 10? You pick the 10 based on the most impact, the return on investment, the cost benefit of those things. And then from home and work, similar thing, like, I figured out what was important to me. I figured out that I want to spend time with my friends. So I put up a tent outside, so we can be distant and outside with our masks on with a couple of friends. I learned to let my husband know that a week from now I have a 3 a.m. meeting, so that, he can figure out what he needs to do around my 3 a.m. meeting. I got headphones, for that. So I think, like, looking at what's important, and you got to do those first, and you got to negotiate and talk to everyone around you about the things you cannot do, or they can help you with figuring out what's the most important.
Thank you. Let's see here. So people in nonprofit work and philanthropy work want to change the world for the better. Do you think we're doing it?
I think we are. This is the optimism side of the Gates Foundation. We can look up and send you data if you'd like that, after the call. But generally, if you look at the statistics of people being able to improve their lives and having the opportunity to improve their lives, it's definitely, on that trend, for the better. So it's kind of like, a similar example would be COVID again today. If you look at the numbers in the USA, we had this really big, steep challenge when it was new, and now it's getting better and the numbers are decreasing. The number of people who have COVID are decreasing. And so similarly, in that way, if you look at the number of deaths in the world, if you look at number of kids, if you look at number of girls going to school, those are all continuously improving over time. And I think you can definitely find those on, Bill Gates has a page. Bill and Melinda call themselves the Impatient Optimist, and they have a page that shows some of that data, or happy to send you a link afterwards. Let me just say one more thing. I think sometimes it seems the opposite, and I think that's because we're so able to share so much news and information from around the world. So sometimes you just hear sort of the sad stories more than you hear the happy stories. And maybe sometimes, I'm not sure what you were thinking of, but maybe sometimes that's what you hear and see so much more of.
Yeah, I think our news cycle definitely focuses on those more challenging aspects. So we see those a lot more. So it's so great to hear your perspective on that. So for our very last question, this might be a hard one. Favorite place you've ever traveled?
Oh, my current favorite right now, especially being stuck at home, was Oman. The beach in Oman was amazing. And I was in Pakistan for work. Pakistan is 26 hours flight away. And on the way home is Oman, 2 hours from Pakistan. And I had to switch planes anyway. So I went to the beach. And my husband met me there, and we just hung out for the December holidays. And it was awesome, and it was warm and toasty. And that's probably what I miss right now the most.
Oh my gosh, that sounds like a dream right now. A nice warm beach somewhere, not in Washington. Wonderful. Thank you so much. We are just about at time. So I want to thank you all again for joining us this afternoon, and thank you to Tasleem for your time and expertise, and Ken and Luther Burbank Savings for your support of this program. I went ahead and put a feedback survey link in the chat box. If students could please take a few minutes to complete this survey. We'd love to hear your feedback so we can continue improving these programs, and you'll be entered in a drawing to win a Starbucks gift card. So appreciate your time in advance. Our next Lunch with Leaders session will be on March 3rd, featuring Gina Steiner, who is the managing attorney with the Port Gamble Slalom Tribe. And so we hope to see you there. So Tasleem, thank you so much for your time. It was so wonderful hearing about your story and your why. And we appreciate your support of junior achievement. Hope you have a wonderful afternoon, everyone.
Thank you. Thank you to you all. Thank you, Ken. Thank you, Leah.
Thanks.
All.
Bye.